If you are an elderly woman over 60, there is a silent threat that may already be living inside your skull right now, and your body has very likely been trying to warn you about it for weeks, months, even years. I am Dr. Rachael Augustine, and in the next few minutes, I am going to walk you through 10 warning signals your brain sends out before a brain aneurysm ruptures. Some of these signs are exactly what you'd expect, a headache unlike any other, but others will shock you. One of them shows up in your lower back, another one shows up in your stomach, a symptom so far removed from the brain that women see 3 or 4 different specialists before anyone thinks to look at the one organ actually responsible for it. Here is the number every woman over 60 needs to hear. When an aneurysm ruptures, nearly half of patients do not survive, and almost a third of the survivors are left with permanent, severe disability. But here's the part almost nobody talks about. Caught early, before rupture, that same aneurysm can be treated with a procedure that carries less than a 2% mortality risk. The difference between those two outcomes isn't luck, it's recognition. It's knowing what your body is trying to tell you before it's too late. So stay with me to the very end, because symptom number 1 on this list is the one most frequently dismissed as just stress or getting older, and it's the one most doctors don't connect to the brain at all. Now, let's quickly talk about why women over 60 are especially at risk. Brain aneurysms, abnormal ballooning in the wall of a blood vessel feeding the brain, affect roughly 3 to 5 out of every 100 people. Most stay quiet for a lifetime, but some grow, and eventually some rupture, flooding the space around the brain with blood in what's called a subarachnoid hemorrhage, a medical catastrophe with a mortality rate north of 40%. Studies published in the journal Stroke show something striking. After menopause, when estrogen's protective effect on blood vessel walls fades, women face aneurysm rupture rates roughly 60% higher than men. That's not a small gap, that's a massive, underappreciated gender disparity in brain health. And here's the tragedy at the center of all of it. The Brain Aneurysm Foundation reports that somewhere between 40% and 60% of people who suffer a rupture experienced warning symptoms in the days or weeks beforehand. The aneurysm was trying to announce itself. The body was sending signals, but those signals were waved off by patients who didn't want to make a fuss, and sometimes by physicians who simply didn't connect the dots. That ends today. Everything I'm about to share comes from peer-reviewed research published in journals like Neurosurgery, Stroke, Neurology, and the New England Journal of Medicine. Not speculation, not fear-mongering, but documented clinical evidence. Before we go further, if this kind of life-saving information matters to you, do 2 things right now. Hit subscribe so you never miss one of these breakdowns, and tap that like button. It's the single biggest factor in whether YouTube shows this video to another woman who might need to hear it today. And if you have a mother, sister, aunt, or friend over 60, send her this video right now. It might be the most important 3 minutes you share with her all year. All right, let's get into the 10 signs, starting with the most recognizable and building toward the one almost everybody misses. The first sign on my list is the headache that doesn't behave like any other. The most classic warning sign is a sudden, severe headache that hits its peak intensity within seconds, not minutes, seconds. Patients describe it as being struck in the skull with a bat or feeling like their head is splitting open from the inside. Doctors call it a thunderclap headache, and it's often the result of a small leak from the aneurysm wall, a preview, in effect, of the larger rupture that may follow. What makes these warning headaches so dangerous is that they can fade. 30 to 50% of people who eventually suffer a full rupture experienced one of these smaller headaches days or weeks earlier, and because the pain eased up, they wrote it off as an unusual migraine or a stress headache. Here's how to tell the difference from an ordinary headache. It arrives instantly rather than building gradually. It's at its worst the moment it starts rather than worsening over hours. It tends to feel like pressure across the whole head or concentrated at the back of the skull and neck rather than one-sided, and over-the-counter pain relievers barely touch it. If you add nausea, vomiting, a stiff neck, sensitivity to light, or even a brief blackout, this is not a headache to sleep off. Call emergency services immediately. Do not drive yourself. Do not wait until morning to see if it passes. The window between a warning leak and a catastrophic rupture is often measured in days, not weeks. The second sign on my list is when your eyes start telling on you. As an aneurysm grows, it doesn't just sit there quietly. It can press on the nerves that control your eyes. One of the most common culprits is an aneurysm forming where the posterior communicating artery meets the internal carotid artery, putting direct pressure on the third cranial nerve. The result can be a drooping eyelid, double vision that worsens when you look in certain directions, and a pupil that no longer reacts properly to light. If you ever see a drooping lid paired with a dilated pupil, that's considered a neurosurgical emergency. It signals a large aneurysm at real risk of imminent rupture. Other aneurysms compress the optic nerve or the optic chiasm itself, narrowing your peripheral vision into something resembling tunnel vision, or dimming sight in just one eye over time. Research in the Journal of Neurosurgery found visual symptoms in 15 to 30% of patients with unruptured aneurysms. Many women chalk these changes up to cataracts or simple aging eyes, and sometimes that's exactly what it is. But any new double vision, drooping lid, or field of vision loss deserves a same-week visit to both an ophthalmologist and a neurologist, with imaging to rule out a compressive lesion before any vision loss becomes permanent. Facial pain or numbness that won't quit is the third sign I'll be discussing. The trigeminal nerve carries sensation across your forehead, cheeks, and jaw, and it sits close to two common aneurysm locations, the cavernous segment of the carotid artery and the tip of the basilar artery. When an aneurysm presses on this nerve, it can produce facial pain or numbness that's frequently mistaken for trigeminal neuralgia, a well-known nerve pain condition. The key difference: classic trigeminal neuralgia tends to fire in brief electric shock bursts lasting only seconds. Pain from an aneurysm pressing on the nerve tends to be steadier, and it tends to get worse, not better, as time passes. If you notice numbness, a weakened ability to chew, or a dulled response when your eye is lightly touched, don't accept a trigeminal neuralgia diagnosis without imaging first, specifically an MRI angiogram focused on the cavernous sinus and the back of the skull. The fourth sign is a stiff neck that has nothing to do with sleeping wrong. When blood, even a small amount, leaks into the space surrounding the brain, it irritates the protective membranes called the meninges. That irritation produces neck stiffness, particularly when paired with a sudden headache. This combination, severe headache plus a neck that resists bending forward, shows up in roughly 25% to 40% of patients in the days before a major rupture. It's the body staging a small, survivable preview of a much bigger event. If this happens to you, this is not a wait-and-see situation. It calls for an immediate CT scan of the head, and if that comes back clean, a lumbar puncture to check for blood breakdown products that imaging alone might miss. Sign number 5 is pupils that no longer match. Take a moment right now and look in a mirror. Are your pupils the same size? Unequal pupil size, especially paired with a headache or any vision change, is one of the more specific signs of third cranial nerve compression from a growing posterior communicating artery aneurysm. Because the nerve fibers controlling your pupil sit right on the surface of this nerve, they're often affected before drooping or double vision ever develops. This means unequal pupils can be the very first clue your body gives you, sometimes weeks before any other symptom appears. Doctors call this a surgical third nerve palsy because, unlike pupil-sparing nerve issues from diabetes or high blood pressure, this version points straight to a structural problem that needs a neurosurgeon's attention. If anyone, a friend, a family member, even a photo, points out that your pupils look different sizes, treat that as a reason to get urgent imaging, not a curiosity to mention at your next routine appointment. Sign number 6 is when your mind feels like it's not quite yours. Confusion, trouble concentrating, slower thinking, and memory lapses can all stem from an aneurysm pressing on the frontal lobe, particularly aneurysms that form at the junction of the two anterior cerebral arteries, right next to brain structures essential for memory and planning. The reason this gets missed so often is that it looks exactly like what we expect aging to look like, but there's a tell. Degenerative memory conditions like Alzheimer's progress slowly, over months and years. Cognitive changes from a growing aneurysm tend to appear faster, over days to weeks, and they can fluctuate sharply, sharp on some days and foggy on others. in a way typical dementia rarely does. Research shows cognitive symptoms in 10 to 20% of people with large unruptured aneurysms. If something about your thinking has changed and it doesn't feel like a slow fade but more like a switch was flipped, push for an MRI and MR angiogram before accepting early dementia as the explanation. Sign number 7 focuses on hearing, ringing, and a world that seems as though it won't stop spinning. Aneurysms forming along the basilar or vertebral arteries, the vessels supplying the back of the brain, can compress the 8th cranial nerve, which carries both hearing and balance signals from your inner ear. This can show up as sudden hearing loss in one ear, ringing or buzzing that won't stop, vertigo that makes the room feel like it's spinning, or unsteadiness that pulls you to one side while walking. These symptoms overlap heavily with far more common, benign conditions: age-related hearing loss, inner ear disorders, positional vertigo, which is exactly why the rare aneurysm hiding underneath gets missed. It happens in roughly 5 to 15% of people with aneurysms in this part of the brain. If you experience sudden hearing changes or balance trouble that feels different from anything before, ask specifically for an MRI of the back of the skull, along with an MR angiogram. Don't let it get filed away as just your ears. Another important sign to note is this one I have as number 8 on my list: a seizure with no explanation. A first-time seizure after the age of 60 should never be brushed off as a one-time fluke. It can result from an aneurysm physically irritating brain tissue, disrupting local blood flow, or leaking microscopically into surrounding tissue. Aneurysms near the middle cerebral artery are especially associated with seizures because they often sit close to the temporal lobe, a region of the brain especially prone to triggering seizure activity. Whether the seizure affects one part of the body or the whole body depends on exactly where the aneurysm sits. The bottom line: any new seizure in an older adult warrants full brain imaging, full stop, to rule out a structural cause like an aneurysm before anything else. Sign number 9 is the exhaustion that doesn't make sense. Sometimes a large aneurysm, particularly one that's developed a clot lining its inner wall, triggers a low-grade, body-wide inflammatory response. This can show up as profound fatigue, a vague sense of being unwell, low-grade fevers with no infection in sight, and elevated inflammatory markers on routine blood work. It's easy to see why this gets misdiagnosed. It looks identical to chronic fatigue syndrome, fibromyalgia, or depression. Research suggests this kind of systemic inflammation shows up in 20 to 30% of patients with larger aneurysms, sometimes appearing months or even years before any rupture. The detail that should raise a red flag is pairing this fatigue with even a mild, easy-to-dismiss neurological symptom: a passing headache, a flicker of blurred vision, a moment of confusion. That combination is what should push you or your doctor toward brain imaging rather than another round of blood work looking for a virus that isn't there. The last sign on my list, which is the 10th, is the one almost nobody connects to the brain. And now, the symptom I promised you at the very beginning, the one tucked so far away from the skull that it sends women straight to gastroenterologists and orthopedic surgeons, while the real problem goes untouched. Lower back pain combined with vague abdominal discomfort, bloating, or unpredictable bowel changes can, in rare cases, trace back to an aneurysm in the posterior circulation, the basilar or vertebral arteries, pressing on autonomic control centers deep in the brainstem. These centers regulate digestion and pain signaling throughout the entire body. When they're disturbed, the pain doesn't stay in the brain, it gets referred outward into the lower back, the pelvis, the gut. It sounds almost too strange to be true, but research in the Journal of Neurosurgery found that 12 to 18% of patients with aneurysms in this part of the brain experienced exactly this kind of lower back or abdominal discomfort in the months before diagnosis, and not one of them or their doctors initially suspected the brain as the source. These women underwent colonoscopies, abdominal scans, and spine imaging, all of it normal, because nobody was looking in the right place. The clue that should make you pause is this: if your back or stomach symptoms show up alongside any other item on this list, a strange headache, a balance issue, a flicker in your vision, and standard treatment for back pain or digestive issues simply isn't working, That combination deserves a conversation about brain imaging, not just another round of physical therapy or antacids. Let's quickly do a recap of what we covered today. A sudden, thunderclap headache unlike any before, new vision changes or a drooping eyelid, facial pain or numbness, a stiff neck paired with headache, pupils that no longer match, cognitive fog that arrives fast rather than slow, hearing loss, ringing, or vertigo, an unexplained first seizure, exhaustion that doesn't add up, and finally, that surprising combination of lower back and abdominal discomfort. None of these symptoms on their own means you have a brain aneurysm. Most of the time, there's a far more ordinary explanation, but these are documented, evidence-based warning signs, and in 40 to 60% of rupture cases, at least one of them showed up beforehand and was missed. A CT angiogram or MR angiogram takes minutes and can detect aneurysms as small as 2 to 3 millimeters. Weigh that against the alternative, a rupture event with a 40 to 50% combined risk of death or severe disability, and the choice to ask the imaging stops being a hard one. If even one of these symptoms sounded familiar to you, I want you to do 3 things before you close this video. First, write it down and bring it to your doctor by name, not vaguely. Second, subscribe to this channel because I cover the warning signs your body sends before the conditions that matter most every single week. And third, share this video with a woman in your life over 60, a sister, a friend, your own mother. This might be the video that gives her the words to finally say, I think we need to check this, instead of staying quiet. Drop a comment below and tell me which of these 10 symptoms surprised you the most. I read every single one. Thank you for spending this time with me. Take care of that incredible brain of yours, and I'll see you in the next video.